Hello, I'm Liz, one of Derry's reference librarians, and welcome to another episode of Misinformation Busters. Once a week, we tackle a rumor or false misunderstood information and try to separate fact from fiction. This week, we're taking a break from geopolitics and talking about more of a misunderstanding, the idea that COVID-19 and the flu are roughly the same. So, what's the story? Well, before COVID became the pandemic it is now, a lot of people underestimated how much of a problem it would be, myself included. I figured it would be similar to SARS and we would just have to wear masks. There's also genuine confusion, such as the fact that COVID and the flu do share some symptoms, such as chills, fatigue, and fever. And early on, people with platforms, such as Fox News personalities like Sean Hannity, said that it should be compared to the flu, as did conspiracy theorist Alex Jones, who, let's be honest, his story changes day to day. One day COVID is just like the flu, the next he has someone from Natural News on saying it's over for humanity. Even the president compared COVID to the flu in early March. And though the rhetoric has changed as it's become apparent that COVID is a problem, you still see this idea in the comment sections of the internet and fringe health sites. And now we are seeing people ask, why are you shutting down everything for this? We have thousands of people die from the flu every year. So, what are the facts? Well, let's start with numbers. As of right now, we have over 63,000 COVID deaths. And this is from March. The flu, on the other hand, the CDC estimates that between 12,000 and 61,000 will die annually since about 2010. So we are looking at the worst case estimate for a year of the flu within 2 months. And the last 6 flu seasons actually range from about 3,000 to 15,000 deaths. So we are looking at something that has a higher mortality rate than the flu, to say the least. We're also seeing more severe cases that require hospitalization, close to 20% rather than usual 1 to 2% of flu cases. Dr. Stephen Novella of The Skeptic's Guide to the Universe actually makes this point about how this differs. Hospitals. The flu season usually lasts between 6 to 8 months. And this again, COVID, has only been happening for about 2 to 3 months. Hospitals can handle a normal, even a bad flu season because they've planned for it. And the flu season is over a longer period of time. So the fact that COVID hit us so hard over such a short amount of time and has a higher hospitalization rate, this is one of the reasons hospitals are having trouble and why we're distancing to prevent further overwhelming. Dr. Pratish Tosh of the Mayo Clinic said in an interview about the whole social distancing thing, this is not overhyping. These are rather unprecedented social maneuvers that are likely to help keep otherwise vulnerable people from getting sick and dying. And there's also a difference in symptoms. While COVID and the flu share symptoms, there are 2 big differences we're seeing with COVID. Longer incubation periods, 2 to 14 days with COVID versus 1 to 4 for the flu, and asymptomatic infections. Dr. Simone Wiles of South Shore Health explains, quote, in general, when the flu hits you, your people lie in bed and don't go out. But something we're seeing with COVID-19 is that because the symptoms are mild for most of the population, they can go out and spread the disease quite easily, especially given how long it can be infectious for. And this is why we're wearing masks. Not out of fear, but out of the assumption that we may be asymptomatic carriers. Also, this is still being studied. There are new symptoms like COVID toe that are not flu-like at all popping up. Also, as long as we're talking about the flu is a serious problem. Dr. Novella correctly notes that people bringing up the flu just downplays, intentionally or otherwise, the severity of COVID-19. But this shouldn't be the only time we care about the flu. Plus, it ignores the medical experts that don't ignore the flu. I mean, every year we hear about good hygiene during flu season and what to do if you think you're sick. And we also have a flu vaccine, which we don't for COVID-19. Scientists and medical professionals know what to expect from the flu. We don't know what to expect from COVID-19, which is why for now the best practice is to listen to medical professionals about both COVID-19 and the flu. Thank you for watching, and as always, look for sources in the comments, and if you want to do some research, you can use our EBSCO databases available through the library's website. See you next week.